So we're going to talk about the OShot. So the OShot is something that is frequently inquired about. And so we want to give you some information that you will have before you even enter the office. Again, it's called the OShot. So with the OShot, we're looking to improve lots of different things, but incontinence is one of them. So if over time you start to experience where you're jumping on the trampoline and you have some urine spillage, or you're leaking urine when you're active with your kids, or you're jogging, that becomes a problem. And that is something that we start to experience with age, after childbirth, just hormonal decline in general. Vaginal pain, and again, my writing is not always that wonderful, but vaginal pain, dryness, and decreased orgasms over time. That is something that happens after multiple childbirths and hormonal decline. So if we look at the vaginal canal, this is a cross section of the vaginal canal, and this is the urethra. And so what happens is with pregnancy, we have a lot of weight that comes down in this area. This again is the urethra. This is where we're urinating from. And in between this is a space, and that space becomes obliterated with all the weight of the pregnancies. So we need to regenerate that tissue. The G-spot is in that anterior vaginal wall. So what we found was we were trying to regenerate tissue just to get improvement of incontinence, and what we found was we actually improved orgasmic strength as a added boost to the OShot. So we draw blood, we spin it down, we get the platelet-rich plasma part. So we're going to end up injecting PRP into this space, and we're going to get improvement of collagen and elastin. We're going to stimulate growth in that area, nerves and blood vessels to the G-spot area. So you're going to get improvement in urinary incontinence, but as an added benefit, you're going to get increased orgasmic strength. It helps with vaginal dryness, vaginal pain. We're using your blood to repair tissue and get improvement of symptoms that have been bothering you. These are ways to improve that without surgery. Whenever we cut on the body in any way, we're interfering with function of the body, with the organs. And so we don't want to do that. We want to stimulate repair of your own body, and we do that with PRP. And we can also do what's termed vaginal rejuvenation with lasers. So we would use a probe, and that probe goes through the entire vaginal canal, heats up the tissue. Our devices are non-ablative, so we're not going to break down tissue. We're just going to heat and stimulate repair. And we're going to get tightening. We're going to get, again, increased lubrication, increased orgasmic strength, help with urinary incontinence. And we also hit the clitoris with both the OShot and the vaginal rejuvenation with lasers. So again, in combination, these procedures are phenomenal at improving urinary incontinence, pain with sex, dryness, orgasmic strength that happens to decline with age almost with everyone. Is it painful? Is one of the questions people ask, and it's not. Again, we've been doing this for years. I train other physicians to do it. We know exactly how to place it. We do blocks, we numb everything. So most patients have this for pain, a big 0. So 0 out of 10. It's an in-office procedure, no downtime. You can have sex that night. To get sustained results with any of this, we really do want to, if you're at an age where hormonal decline might be an issue, we want to check that and just make sure your hormones are optimized too. We can't always guarantee that the body's going to respond, but we at Revitalyze MD know exactly how to do the procedure, and we use the best kits possible. So if you're going to get response, it's going to be with us. So if any of these symptoms are things that you are experiencing, incontinence, vaginal pain, dryness, decreased orgasmic strength, even laxity, either on the outside or the inside, then please give us a call so that we can talk and we can decide whether these procedures are right for you.